Good evening, everybody, and welcome to everyone who's joining us live here on Facebook and on YouTube Live. We just want to thank you for joining us with this crucial conversation around mental health matters, kind of breaking the stigma for teens and young adults. My name is Dr. Daniel Bond, and I will be your moderator for the evening. Um, just a brief note about me, I'm a licensed psychologist here in Tampa. I'm also the president of the Bay chapter for the Florida Psychological Association. And I'm also a gay dad and a father. So mental health of teens and young adults, they mean a lot to me. So I'm really happy to be involved in this process and to be here with you all. Tampa General Hospital is proud to have joined forces both with Frameworks and the Florida Psychological Association to bring you this Facebook and YouTube Live event. We're trying to provide answers to your questions from our medical experts and teens and young adults who have overcome their own adversities. And our real hope for tonight is that you hear from teens about what their experience has been like as well, because each journey is personal. And it's important to know that personal element of this. Before we get started, though, I definitely want to go through a few housekeeping items and maybe even a few disclaimers as well. This event is being recorded and will be available for viewing later. This event is really intended to be an educational forum for the public. So because of that, this video event is not intended to be professional or legal advice. It's not a treatment group. It's not group therapy. We really want to encourage you to be sure to seek the services of a professional if you're in need of them. And as always, should you ever be experiencing a mental health emergency or need immediate assistance, always please call 911 or go to your nearest emergency room as well. The next hour that we are going to spend together is really meant to address kind of a lot of mental health questions that come up for both teens and young adults. We're also going to try and answer some of the questions that have been submitted to our expert panelists, as well as to our teens and young adults. And if you have a question during this event, feel free to place them in the comment section of the Facebook Live kind of feed. We did have several questions already submitted related to mental health medications. And because of that, and based on the scope of our panelists that are here today with us, we really want to encourage you to consult with your medication prescriber about all medication related matters. And the reason is because the answers to those questions are pretty complicated. And really it means that it's a conversation we want you to have with your prescriber. We will do our best to answer all of the other questions that have come in within our allotted time. But please do make note that the goal of this is really to have an open discussion. And so we may not be able to get to every one of these questions that come in. However, we will have contact information at the very end of this presentation. And so if you do have any questions that come up, or if you wanted to follow up with any of our panelists or expert panelists, you will have the opportunity to do that as well. One last item, and that's just really concerning the ever-evolving nature of kind of COVID-19 and coronavirus, is that, any discussions related to those items today, we just want to let you know that the situation always continues to evolve and change. So the information that we're sharing today is accurate as of our current practices in place as of today. So I'm very excited to really introduce each of our expert panelists here and our brave teens and young adults that are joining us here today. So what I would like to do now for each of our attendees here is, as I mention your name, just please give us a brief introduction to yourself and introduce us to your audience here on Facebook Live and on YouTube. Let's start with Dr. Nicole Williamson.
Thank you very much. I'm a pediatric psychologist at Tampa General Hospital, and I'm really excited to be a part of this panel tonight. As part of my role at the hospital, I work inpatient on the pediatrics floor and outpatient. I have a medical coping clinic. I work primarily with children and young adults who are navigating significant medical issues, and then all of the co-occurring psychological challenges that can bring. As we know, there's such a link between our physical functioning and our emotional functioning. So helping teens and young adults to navigate that, and happy to be here tonight.
Great. Thank you so much, Dr. Williamson. We really appreciate your expertise on our panel tonight. Next, I just want to introduce Dr. Qureshi, and she is the Chief Officer at Frameworks. And if you can tell us a little bit about yourself and your organization.
Of course. Thank you so much, Dr. Bond. I'm Qureshi, and rather than being a medical doctor, I'm actually a doctor of education, meaning I study how we develop into healthy adults and what supports are necessary along the way in terms of being proactive to support healthy development. And I am fortunate to serve with educators, youth services, professionals, parents and guardians, and sometimes students themselves, students of all ages, to equip us with social and emotional skills. And sometimes this involves working with young people directly to build that skill set, as we are doing this evening. And we refer to this as social and emotional learning, or SEL. And the idea there is not waiting until we're at a point of needing intervention, although that will still happen, but ideally being proactive about building those skills so that we all have a toolbox for reducing anxiety, for acknowledging that it is a built-in part of life, especially this year, right? And dealing with it in constructive ways, talking about it before it becomes a point needing intervention. And I'm thrilled to be here tonight. You can learn more at myframeworks.org, but thank you so much for having me.
Thank you, Dr. Qureshi. And last, for our expert panelist, Dr. Andrea Ansha. Can you introduce yourself and tell us a little bit about you?
Yes, thank you, Dr. Bond. Good evening, everybody, and thank you for joining us on our live virtual event. I am a licensed clinical psychologist in the states of Florida and California. I am also the treasurer for the Florida Psychological Association's Bay chapter. I'm currently in private practice, and I've been working with high-risk youth and their families for nearly 20 years now. My areas of specialty include the treatment of mood and anxiety disorders, which we're definitely seeing a lot of in this corona climate. I also treat non-suicidal self-injury, eating disorders, substance abuse, sexual abuse, and other traumas. I'm really passionate about working with girls and young women and helping them navigate issues like body image, perfectionism, high pressures to achieve, their interpersonal relationships, and helping them manage their intense emotions. I am a mother. I have a preteen daughter and a teenage son, so I understand firsthand the challenges that parents face, and particularly, again, during these rough times. And, you know, the challenge of raising independent, thoughtful, hardworking, and kind individuals in a culture of a 24/7 connected world. So I'm really excited to be here this evening, and thank you so much.
Great, and thank you, Dr. Ansha. And now I want to introduce our teen and young adult expert panelist here. And we're going to start with Shawn Barnett, and he is our 17-year-old panelist. And Shawn, can you just introduce yourself and tell us a little bit about you?
Yes, of course. Thank you, Dr. Bond. My name is Shawn Barnett. I'm a 17-year-old living outside of Tampa, Florida. About 9 months ago, I was diagnosed with osteosarcoma, which is a type of bone cancer found in my my left tibia. And just last week, I celebrated and rang the bell to celebrate me finishing my chemotherapy treatment. So that was very exciting. Going forward, just kind of why I believe mental health is very important, and what I would like to tell people is positivity is the best medicine. And I hope going forward, people are able to feel more comfortable with talking about it to their friends and family, and they get a better sense of just a more positive feeling in their body. So thank you.
Great. Thank you, Shawn, so much. We're so excited to have you join us here. And next, we want to introduce Veronica Turner. She is our 18-year-old teen panelist expert. Veronica, introduce yourself and tell us a little bit about you.
Yeah, so as Dr. Bond mentioned, my name is Veronica. I am 18. I am born and raised in South Tampa. And about 2 years ago, I was diagnosed with something called Ehlers-Danlos syndrome, which is a very complex connective tissue disorder that has caused multiple other chronic illnesses that has kind of left me in a place where I've been in this quarantine for about 2 years now. And on top of that, I also struggle with anxiety, ADHD, low mood sometimes. But my main thing is chronic illness advocacy and invisible disability advocacy. As you know, it's really difficult to be a teenager in the world in these times, especially when you have something as insane as a pandemic. And so for me, I'm really striving to, make the focus on having a chronic illness, that you are more than that. There is more to you than just your diagnosis. But It's a slow and steady process, and I'm really excited. And I also, I run an Instagram page that I just started for advocacy and stuff. And so, if anybody is struggling with anything, I just kind of want everybody to know that that's normal, that's valid, and to really enforce that no matter what is happening, your feelings are super valid and they're yours, and to accept that as well.
Great. Thank you so much, Caitlin. We really appreciate it. And we're so excited to have you join us as well. Actually, my apologies, Veronica. And then Caitlin Rind is our next panelist here. She's our 21-year-old young adult. And Caitlin, can you introduce us to yourself and tell us a little bit about yourself?
Yeah, thank you. Hi, I'm Caitlin, and I'm 21 years old. I'm a student at San Diego State right now, and I'm studying psychology. And I'm in my last year right now, which is really exciting. But I've struggled with anxiety and depression as long as I can remember, like some of my earliest memories. And when I was 14, I turned to substance abuse as a way of coping with all of the emotions and all of the sadness that I was dealing with. And I was fortunate enough that when I was 15, I was able to attend a year-long rehab program in Utah, which completely changed my outlook on everything. Like, I was given all of the tools that I needed to move forward in life and be successful. I recently celebrated 5 years of sobriety, which is a milestone really important to me. Being a college student, it's not that normal, and I just want people to know that like changing is very possible if you invite it in, and that there is no shame in seeking out the help that you need, because it gets you to where you want to be eventually.
Great. Well, again, thank you, Caitlin and Veronica and Shawn, for being our teen and young adult expert panelists, and to our other experts as well. We are very excited to kind of jump into some of the questions here to really get your thoughts and perspectives on these questions. So we'll begin our conversation with our teens and our young adults. And this question will be directed again towards Shawn and Veronica and Caitlin. Here's this first one, and this one came in from our panelist, is how can I support my friend who is struggling with mental health? Would Shawn or Caitlin or Veronica, which one of you would want to start with that question?
Maybe start with that. The first thing is, it's difficult when you are struggling with something like that, because trust is one thing that is really important when you have a relationship with someone. And so if you are, if you're feeling super afraid to the point where like you don't want to ruin your relationship with them, there are always ways to contact outside resources that can reach out to them, and also just encourage them to be open and communicate with their parents, and if needed, crisis text lines and hotlines. But it's hard, and taking that first step to tell somebody that you need help is essential into your healing. And so there are people who struggle with this all the time. And so know that like you will be met with love. And if not, then, of course that's hard, but I feel for everybody. But yeah, just communication.
Great. Thank you so much, Veronica. And how about Caitlin or Shawn? Either of you have thoughts on that question?
Yeah, sure. I believe a big thing is patience. Veronica mentioned a very important thing, and that's trust. And, sometimes even depending on how long your relationship might be with this friend or whoever you're trying to help it may be short, it may be long, but still there's mental health is a very hard thing to talk about with some people. So you just need to be very patient with them, and recognize sometimes that I believe, just like through my experience when someone has come to me about things, is you really need, and it sounds very simple, you just need to put yourself in their shoes, because depending on the person, I had to deal with cancer, but some other person might feel like some other things are very important to them, or very hard for them, and that's okay. All problems should be seen as equals, I believe. So be very patient, and make sure you put yourself in their shoes to try to get out there seeing it.
Great. Thank you so much, Shawn. And how about Caitlin? Any thoughts on that question?
Yeah, Shawn brought up a really good point about just having empathy for what someone is going through, because even though it might look different than something that you've been through, we've all experienced pain, and we all know how that feels. And a lot of the time, sometimes if someone comes to you and is struggling with something, they don't necessarily want advice or they don't want you to fix the problem. They just want to be heard. And so really being able to like validate the people that are coming to you and just, sharing like these very vulnerable things with you is so important. Making sure that they know they're not a burden on you to be, sharing um, their struggles and encouraging them to reach out to someone who can help them professionally.
Thank you so much, Caitlin. I definitely am like hearing a theme here of kind of that authentic support kind of piece. And now we want to kind of pivot to our expert panelists to kind of get their thoughts on how to answer this question. Again, the question is, how can I support my friend who is struggling with a mental health kind of symptom or condition? And maybe we can start with Dr. Qureshi. Dr. Qureshi, how would you respond to this question?
Sure. I do want to commend our young panelists for being very much on point with this. At Frameworks, we talk a lot about how all feelings are normal and okay. So actually, we do not allow the words good and bad feelings. They are either comfortable or they're uncomfortable, but they are all part of life. And quite frankly, being a teen or a young adult today is very challenging. Young people have more choices of careers today than their counterparts did even a generation ago. More choices in general. I can think of any dish I want and have it on my doorstep in a half hour. And that can be really overwhelming in itself. But when you add to that the pressures of social media and to take 400 AP classes and get into the best college, we've really created a recipe for a generation that is heavily impacted by anxiety and depression. And so that is why being proactive and building skills for navigating this is so important. And part of that skill set is knowing when to ask for help and knowing when and how to be vulnerable. To Veronica's point, and Shawn mentioned the importance of simply laying it out and sharing your story and not being afraid of that judgment. And as a listener, Caitlin, I couldn't agree more. Sometimes it's really tempting to be a fixer and we want to say, oh, don't worry, it will be okay. When in fact, that can minimize the other person's experience. So instead, perhaps a response of, I bet that's really hard and I'm here for you. That can go a long way in validating somebody's challenges.
Great. Thank you, Dr. Qureshi. And actually, moving on to our next question for our team panelists, just because, again, you have so much knowledge that we want to know more about from that perspective as this next question, and maybe we can start with this one, maybe I'm going to Caitlin, if you want to respond to this question first. But this next one came in of how can I support my friend who is struggling, maybe even suicidal, without betraying their trust? Like, from your perspective, how would you answer that question?
I know personally for me, I wouldn't be where I am today without the close friends in my life who, had the courage to go to my parents and say, like, Caitlin is not okay. Like, she's got a lot of stuff going on and, you don't see all of it, but she's just not okay. And they were very general about it. They weren't, sharing anything specific in that sense of betraying trust. But they let my parents know, like, she's really struggling and you're not seeing everything that's going on. And without them, I wouldn't be here. And I was really angry at them for a while. I was really upset thinking that they did betray my trust when in fact, like, those are the people who are still with me today. Those are the people that are always checking in on me and care about me the most and supported me throughout my time in rehab and wrote me letters. And I think it's really important to consider, like, is your friend, like, in danger of hurting themselves? Because at the end of the day, like, they might be upset with you, but at the same time, like, if reaching out to someone for help could save their lives, then, they're going to have to be a little bit mad for a while.
Thank you so much, Caitlin. I appreciate that. And how about our other kind of team panelists, Shawn or Veronica?
Whichever one.
We'll start with you, Veronica.
For me, I feel things a lot. I feel like I might be like an empath and I really try to fix other people a lot and I forget about myself within there. And so I find that it is so difficult for me to do what's best for others because I feel like losing their friendship would be worse than me, intervening. But what I've also learned is that, like Caitlin said, there is no way to get better or even, not to be dramatic, save your life without, if you're really worried about a friend, I feel like that shows that you're truly their friend because you care that much about them. And so, yeah, they might be mad, but understand that they're going through stuff and you can go through stuff with them, but it can get to the point where it's almost kind of like, this is something that I need you to know to help you. And that can be hard.
Yeah. Thank you so much. And let's see, and how about for you, Shawn? Like, how would you respond to this question?
It's hard. It's a very fine line because, like we said previously, trust is so very, very important. And I think when evaluating it, you got to make sure that I believe you got to tell somebody, and that's going to be very hard. But you also need to evaluate who you're going to tell. You you don't want to spread this to everybody. You may want to help somebody, but you got to make sure you're telling the right person because like Caitlin and Veronica said, it could hurt them, but at the end of the day, it could save them. But you got to make sure you don't want that hurt to be so lasting. So be very careful about who you tell. But I do encourage, make sure you tell somebody.
Great. Thank you so much, Shawn. And now actually, maybe we'll kind of ask one of our panelists. So maybe Dr. Williamson, our question here again, how can I tell somebody that my friend is struggling, maybe suicidal, without betraying their trust?
Yeah, I think all of the young adults' answers were just such quality answers, and I'm in a lot of agreement with them. I think, and I really like piggybacking on Shawn's comment of just really thinking about who is the best person to let know that this person's really struggling. So maybe that's a parent, or maybe it's not a parent. Maybe it's a school counselor, or another kind of trusted adult that you know is in their life, but not being afraid to recognize that that person might not realize that they need that help right now, but that you can see that and that that's the best thing for them, and it's coming out of a place of caring for them, and you need them to be able to get the help they need. And really oftentimes that involves enlisting someone else to help them get the care that they need, and you're not really in a place to be able to do that. So it's doing what needs to be done to make sure that they're getting the help they need to move in a different direction.
Great. All right. Thank you so much, Dr. Williamson. And now actually maybe shifting to another question. This one actually is going to be a little bit different because we're going to ask our expert panelists this question first. This one came in through our social media channels. And the question is, my daughter is 23 and she is a college senior and has anxiety and depression. How can I help her? And maybe Dr. Andrea Ansha, you can respond to this question first, and we can hear from our expert panelists.
Yes, thank you. Such a great question. I get calls like this all the time, actually. And to the person that asked this question, I just want to say that your daughter has a very, very loving parent, a loving, concerned parent who is reaching out for help and asking for opinions on how to best support her daughter. So I commend you for that. A lot of what we've actually already talked about, I feel like, is applicable, letting your daughter know that you're worried, that you are concerned, maybe even listing some things that are atypical if their grades are slipping or they're isolating themselves, or maybe a friend's reached out and let you know that, your daughter is struggling, and just start a dialogue. I'm worried about you. What's going on? I'm here for you. I want to help you. I am listening, and see if you can start there.
Great. Thank you, Dr. Ansha. And Dr. Qureshi, how would you respond to this question or add anything else?
My specialty and our specialty at Frameworks really is on the proactive side, ideally before that intervention. But in that work, we do fall on the spectrum of dealing with this sort of issue because it does come down to relationships and trust building. So we've touched on the point to Dr. Williamson's initial point, knowing who to talk to so that you're still not betraying that trust. And I think that starts with the individual, in this case, with the with the 23-year-old daughter. And I would agree with Dr. Ancha that we want to start a dialogue. Now, that said, of course, if that dialogue isn't quite going to a place where the parent feels like this is going to be addressed, then it might be time to investigate what's not quite working. So perhaps a face-to-face conversation would be more meaningful, or perhaps there's a little more trust building that needs to take place before the dialogue around that intervention, if you will. And so those would be a couple of the factors I would think about. As somebody who has experienced anxiety myself throughout my life and has that in her family, I will say I am very grateful for the fact that my family was very transparent about it being an ongoing dialogue, that it is something that runs in our family. So I kind of grew up just assuming I would get it too, right? I would experience anxiety too, and sure enough, there it was. And so I think the more we normalize those conversations, and as parents share our own experiences, it makes it less scary and less intimidating to acknowledge that we also are dealing with those issues.
And I like that, Dr. Qureshi, again, that normalization piece. And maybe Dr. Williamson, what else would you add in terms of a response to this question?
Yeah, I absolutely agree. In terms of just acknowledging your own challenges that you've been through, I think that can help anyone to really recognize that they're not alone and know that this is something that it's okay to be feeling this way. It's okay to ask for help. It's okay to be transparent that this is something that they're really struggling with. And I think when parents take that first step to be transparent, it allows just an open door for young adults to be able to follow. The other thing I was going to say is that I think oftentimes it can be paralyzing when you yourself are in that role. And for this college senior, they may not be sure kind of what to do and how to find help. So, I mean, I think also if it's something that they're interested in, helping them to be able to navigate, maybe finding a more formal counselor or psychologist to reach out to. I think that process in and of itself can be really daunting when you're having a lot of anxiety and depressive symptoms and you call and people don't answer and this sort of thing. So I think also just that logistical help that parents can offer in terms of being the person to help navigate the insurance panel and calling people and letting them know that that there is someone out there that can help provide that more formal support.
Great. Thank you to our expert panelists here. And now actually I want to turn it to our teens and young adults, and maybe we can actually start with Caitlin, actually. Caitlin, for this question, what sort of advice may you have for a parent who's asking, how can I help my 23-year-old and senior in college?
Being a senior in college, I can relate to this a lot, especially right now. There's so much uncertainty, and like naturally, senior year of college, you're getting ready to be an actual adult, and it's stressful. There's a lot hanging over your head, and sometimes it feels like too much. I know I've definitely experienced that a lot, and like with COVID, like there is so much more unknown added to the equation. My parents are a huge support system for me, and I know that I can go to them at any point in time and say, this is what I'm really stressed out about, or this is, I can't get out of bed today. And they've always just been there to listen. And I'm grateful where I already have like a therapeutic support set up, and that's a place that I can turn to also for support. But I also don't think that people realize how many like psychological resources a lot of colleges provide. And they often offer free counseling or like free health services if you need it. And I think that's a great place to start sometimes if you're feeling overwhelmed. Because, they get it. They see it all the time. It can be hard to talk to your parents because, in our minds, like they don't understand it. Obviously, things are really different now with technology and with COVID. And so having someone you can talk to who understands it in context is, it can be really helpful sometimes.
Great. Thank you so much, Caitlin. And how about Shawn or Victoria? Do either one of you have any thoughts to add for this question?
Sure. Yeah. I think Caitlin made an excellent point. I'm a senior in high school. Obviously, I wouldn't say it might be as daunting as being a senior in college, but definitely there is a number of struggles that come with it in the AP classes, and trying to get into college and things like that is very scary for a lot of seniors. And And I think problems like that, on top of COVID, on top of possible mental health, just issues, might it stacks up. And I definitely think it's very important to, if you don't find a support system, maybe it's your parents, to try to find a support system, and that may be possibly in one of your very good friends or in professional health. And I do definitely advise seeking professional health. And I think Dr. Qureshi made an excellent point about normalizing this and making sure you have a dialogue with people, and even if you feel like you're not experiencing mental health issues, I feel like you should still advocate for others and making sure they feel comfortable having that dialogue as well, and that would help break the stigma as we're trying to do. So I believe, yeah, definitely find a support system in some way.
Great, thank you so much, Shawn. And how about you, Victoria?
I have a lot of feelings on this one because I actually had to move online for my senior year because my health just became too much. I had to medically withdraw. And what ended up happening was I was not able to complete my online schoolwork either. And so that was something that was really difficult for me because it was causing me so much more anxiety and stress that my body just couldn't take that anymore. And so we decided to withdraw me, and I'm going to be getting my GED and going to college next year, hopefully. But I really think it's important to understand that, like, not everybody has to have that same path of going to high school to college. Taking that gap year or taking that semester off is a lot more, I think, uncommon because we don't talk about it, but it's something that I feel like would make your education experience a lot better because you would go into it after having the time to work on yourself. Because as Shawn said, like, yeah, there are so many pressures put on high schoolers these days, from classes to art to community service hours to essay writing for the SAT. There's so much put on us. And so realizing that you're not failing if you recognize that you need to move on from something. And also, it's okay to take a break. Take a deep breath. Like, it's totally okay. And you should. But, with COVID, it's so difficult.
Yeah. And thank you again, Veronica. My apologies, I misspoke. I called you Victoria earlier. I'm so sorry. But thank you for the words of wisdom. I think they speak really deeply to a lot of this experience. And actually, another question that has come in as well, I think, and we might direct this one to maybe to Dr. Williamson. With GAD, or generalized anxiety disorder, why do any health symptoms seem real, like you're dying, when that's really not the case? So maybe I can read that again. Why, with GAD, why do health symptoms seem real, like you're dying, when that's not really the case?
Yeah, I think that's such a good question, because I think it can be so confusing, those physical symptoms that we have that are a manifestation of our anxiety, but that just feel so real, and are so real in the moment. That feeling of maybe being sweaty or feeling nauseous, feeling dizzy, feeling our heart racing, all of those physical symptoms that are just a result of how much anxiety we're feeling, in a physical way of expressing how deeply we're feeling anxiety on the inside. To me, I think that just speaks to the power of the mind and the power of our anxiety, in that it comes out in these physical ways. And it can feel like you're actually dying, especially if you might be feeling a panic attack or something like that. That can be a common experience for that. The fact that it does infiltrate not only our thinking, but our physical functioning in those moments, kind of speaks to the way in which we want to try and overcome those moments when they happen. One of the ways that I typically work with people of how to handle those moments might be some grounding strategies, or some strategies that basically will take you out of those physical symptoms, or will take you out of those psychological spinning moments and help you feel present in the moment. So a really good one that I like is the 5-4-3-2-1 method. And the thought behind that is really helping you to just be present and notice your 5 senses. And noticing your 5 senses gets you away from all of those other experiences that are going on. So trying to notice 5 things that you see and trying to notice 5 details around you, 4 things you might touch, 3 things you might hear, 2 things you might smell, and 1 thing you might taste. So that's a common strategy that I would suggest for people when they are experiencing those really overwhelming moments.
Great. Thank you, Dr. Williamson, so much for that 5-4-3-2 method. I like that a lot. And let's see, and Dr. Ansha, is there anything that you would add in terms of response to that question as well?
Sure. I often talk with clients about the amygdala running a fire drill. So the amygdala is the area of your brain responsible for keeping you safe. Sometimes, that's when if you're standing on the sidewalk and a speeding car goes by, it's that urge to jump back. So sometimes it does a really good job and it's accurate. And sometimes it mistakes a stick for a snake. It's not so accurate, but the feeling in your body is exactly the same. Your heart is racing, like Dr. Williamson said, you may feel dizzy and sweaty, but it just means that your body is doing a really, really good job, just not when you need it to be. So the grounding techniques I talk about a lot with clients, they're really effective. Breathing techniques are really effective, but you're not dying. It feels that way, but you're not dying.
Thank you so much, Dr. Ansha. And Dr. Qureshi, anything that you would add to that question or response?
Absolutely. Dr. Ansha, to your point, we also think a lot and talk a lot at Frameworks about what we call amygdala hijacking and going into that fight, flight, or freeze mode, which, yes, sometimes from an evolutionary perspective, it's great news. If a tiger comes into my room, I don't want to make a pro-con list of how to handle it, but we need to be able to turn that mode off and stop that cortisol from firing. I do think it's really empowering to dive into understanding a little more about how the brain works. So actually from an early age, we encourage that with kids and certainly with teens and young adults to learning a little more about, for example, the amygdala, about cortisol, and about how you can lower those levels of stress. So for example, oxytocin, that love and bonding hormone. For some folks, it's a really good strategy to, set a timer for 5 minutes and pet your dog if you're feeling stressed. It sounds very silly, but there is science to it. I love the 5-4-3-2-1 method that Dr. Williamson shared. One thing we focus on a lot also is mindfulness breathing. And there are a lot of different ways to approach that. Certainly there are apps like Calm and Headspace. I know it sounds a little woo-woo to some of us, but I can speak from experience. It does work. That's why there are thousands of years of supporters of mindfulness. And so there's something to that, folks. And I will just say, I think the more that, again, we normalize these discussions and recognize that it is normal to have that overwhelming feeling, the more likely we are to what we call name it, claim it, and tame it. And that's not to say the feelings magically go away, because that's not how anxiety works. But it does empower us to just acknowledge that it's normal and to stay in control of how we choose to navigate through that feeling.
Great. Thank you so much. And for our teen panelists, if you have any thoughts on that question as well. So maybe we can start with Shawn.
Yes, of course. I think groundingness is extremely important, and Dr. Williamson made a very interesting point that about how your mental state can also affect your physical state, and I would like to make that aware that can also work in the opposite direction. If you are positive, then your body will also. Sorry, I'm losing my words. If you think positively, you'll feel better in your body as well. So that's why I preach positive thinking, and I feel like being a pessimist is a common along many teens, and for the longest time I was definitely a pessimist as well. But I felt going through crazy things such as chemotherapy that they told me, hey, if you think positively, you're gonna feel a lot better. A lot of those side effects of nausea and things will go away. And I can tell you, yeah, of course it sounds a little woo-woo, but I can tell you personally, it worked for me. So I think definitely positive thinking is extremely important.
Great, thank you. And how about Caitlin or Victoria? Any questions or any thoughts?
Veronica, but it's okay.
Sorry,
I'm
Veronica, my
gonna jump in
apologies.
on this one because this is something that I hold very near and dear to my heart. I was actually diagnosed with GAD when I was really little, and I was put on medication, and I was put on, I started therapy, and I wasn't getting better. And then as I was in, my sophomore year of high school, I started experiencing those symptoms of anxiety attacks, heart racing, sweating, fainting, nausea, all of that. And it got to a point where I kind of realized that, oh, this might not be something related to my mental health, but this is something that my mental health plays into. And so I did end up getting diagnosed with something called POTS, postural orthostatic tachycardia syndrome. And that basically means that my body is in a constant fight or flight mode. And so on top of that, I have anxiety. And so those two together created a monster. That cortisol, that stress response created so many more issues on top of the ones that I already had. And so the biggest thing I think I want to stress here is that if you are experiencing those symptoms and the traditional therapies and the traditional first line treatments are not working, speak to your physician, speak to your pediatrician, and just say, hey, I am doing everything that you're telling me to do, but I'm not getting better. Because I know that in conjunction, it's horrific. But as I'm now working through it and accepting that I will always have some level of fear about my health on a daily day basis, but knowing that if it's bad enough, it will be caught by a doctor or something of that nature. And so working through that mindfulness and calming and relaxing my body as much as I can, it really does help me manage my symptoms to the point where the medications can work. But also recognizing that health anxiety is so real. So please, please, please realize that it is so normal to have anxiety because of your anxiety.
Thank you so much, Veronica. And again, great words of wisdom from that perspective too. And another question actually that's come in, and maybe we can direct this one towards Caitlin actually. And this one's coming in from our online kind of community is, what suggestions do you have for students experiencing anxiety or depression and isolation during this COVID-19 crisis? Maybe we can ask all of our teen and young adult expert panelists here. And Caitlin, would you mind starting with that question?
I think it's really important to remain connected to someone, regardless of that's someone that you're living with or someone over the phone, but still really trying to establish that social connection is so important, because it's hard enough to be physically isolated, and then on top of that, when you're also socially isolated, it makes it that much more difficult. And also, too, I mean, for me, I've personally been able to step back and take the time to just kind of reset and, remind myself of what's important to me. And for me, a big one is working out and exercising. I really try and use that fight or flight response that I have, with the anxiety to my advantage, and just try and, exercise and just exhaust it, but exhaust it in a positive way rather than just letting my mind run forever. So definitely that, and staying connected with people is super important.
Great. Thank you so much, Caitlin. And how about Shawn, your thoughts on that question?
Of course, yes. I personally, going through when I had to have my surgery on my leg, and going through COVID, nobody could visit me. It was definitely the hardest time during some of my treatment. And I was left at home. I was bedridden. I couldn't do anything, and nobody could come over and comfort me. And that was really hard for me. And so I understand how a lot of people feel currently going through this right now. And I feel like the biggest thing is, Caitlin mentioned an excellent point, is you got to find something. You got to find, she said, for example, exercising. For me, it was music. I would play music, or you write, or you do whatever feels right. And so I feel like you need to find either a hobby or something to do to really help kind of exert those feelings, because it is hard. And of course you need to put your own physical health as well first, and you can't, if you can't see people. So I feel like it's very important to find something. And I also would say that it's okay to sometimes take a second to be alone. I find that, when I first started treatment, there was so much of people saying, "Oh my gosh, this is so bad. I'm here for you. I'm here for you." There's so much support that sometimes it's okay to step back from all that and just be with yourself and have some kind of alone time. So I will say that, you might feel like, "Oh gosh, I'm so I need social connections," but you'll find that eventually you'll still need time alone as well.
Great. Thank you so much, Shawn. And how about Veronica? Your thoughts on that question?
Shawn, I relate a lot. I've had to live a quarantine bedridden life for about 2 years now. And in about a month, I'm having probably one of the biggest things happening in my life. I'm having major surgery that will leave me stuck for 6 to 12 months, another 6 to 12 months bedridden on top of that. And like Shawn said, I have not been able to see any of my friends since March. And with that, I found that actually, as kind of the time passed by in quarantine, I actually ended up FaceTiming my friends a lot more. And I was so grateful for that for many reasons, because when you are isolated, especially in the hospital, I feel like there's really nothing else to turn to except your phone sometimes. And as cheesy and horrible as this sounds, there are so many things that you can bring, like books and stuff. But for me, I hate being this person, but when I was so just like nobody could come because of COVID, and so I downloaded TikTok, and I haven't posted anything, but I spend hours on that app because every time I go on that app, I know I will be able to laugh. And so since the day I've downloaded it, there has not been one day that's gone by that I have not laughed. And as like small as that sounds, it helps because it's just something to distract you. And I feel like that distraction is essential in your healing as well, because when you're all up in your head 24/7 and you really like get down into what's happening in your life and like all the scary things that's happening, that's when I feel like I spiral. And while there are times where that spiraling is so valid and so needed in that grieving process, even if you're just grieving, not being able to graduate with your friends, that is grief. You are losing something major. And so finding those little joys in each and every single day, no matter how big or small they are, to me has made my life so much easier to cope, because I know that at least once per day, I am going to find something that makes me happy, even if it's forced. But it makes me laugh, it makes me smile, and it really does help.
Great. Thank you so much, Veronica. And maybe we can have one of our expert panelists kind of chime in on this question too, maybe Dr. Ansha, of, to the young adults, what suggestions do you have for experiencing anxiety, depression, isolation during COVID-19?
The responses are incredible. Thank you, everybody, for your responses. They're really just, I think, spot on. I have very little to add. I will piggyback on what Veronica said. I had never had TikTok, and people were sending me TikTok links of the cutest little puppy dogs I've ever seen in my life, and the funniest little cat videos. And it is a way to have just a good belly laugh sometimes, and it's so needed. But I do think I'm an extrovert, I'm a hugger. The quarantine was really hard for me. And I think for people that might relate to that, finding some type of connection every single day, even if, we're still leading pretty busy lives in a lot of ways. I work full time, I have my family, but sending a friend a text message, sending a family a family member a text message. Sometimes I send jokes. Sometimes, "Hi, how are you doing? I haven't heard from you, in a week or a few days. Do you want to check in?" And scheduling the Zooms, I do that almost every weekend with different people that are really important to me and that I want to make sure I stay connected with. And that gives me something to look forward to. So even though I can't see them in person, even though I can't give them a hug, I still miss them, of course. And so I can connect with them virtually like we're doing with you all this evening. It's really special.
Yes, thank you. And I think for all of us, our love of TikTok runs deep for these particular things. But I also want to just thank, personally, each of our panelists. We want to thank both our experts as well as, our teens and young adults, but in particular, our really brave teens and young adults. We commend you for your courage, your tenacity, your strength to really come forward and to seek help and to rise above these challenges and obstacles. And honestly, we also want to truly thank you for sharing your experiences here tonight, because this was a small window into what your experience is like. And that's something that no one else can really share. Like, this has been your kind of experience to share. And so we want to thank you for that. Also, to our experts, we appreciate the advice that you've been able to share with us here tonight. And then following our conclusion here, we will share some contact information that will be available along with several mental health resources that will be available for you all. Do not hesitate to reach out if you feel like you need help at any point in time. So we just want to thank again, everyone, and good night and well wishes. And we're looking forward to doing an event like this again to get more teens and young adults to share your stories. So thank you, everybody.